When we think about menopause and hormonal changes with age, most times people are not thinking about their feet. My name is Dr. Emily Splichal, functional podiatrist, and I'm here to speak to you about the effect that female hormones can have on foot health, especially as a woman is going through menopause. Now, when it comes to menopause and hormonal changes, the main one that we're focusing on is estrogen. Estrogen has a deep relationship with collagen. And collagen, which is a very important protein in our body, can be found in our blood vessels, in our tendons, our ligaments, our fascia. It's found in our bone, and it can have an effect on our skin. So when it comes to the foot, there are four main symptoms that I see in women. The first one is that we can start to have arches that fall, and oftentimes this is only on one side, a unilateral one-sided collapse or drop of the arch. Now this is associated with a very important muscle or tendon in the foot, which is called the posterior tibialis. This is a muscle that runs from the inside arch up the lower leg and behind the calf. That tendon is greatly affected from body weight and stress, and then of course, dropping estrogen levels. As we start to strain and stress that tendon because of the hormonal changes, the repair mechanism is a little bit more difficult. This one side flattening is referred to as adult acquired flat foot and is very common in peri and postmenopausal women. A second symptom that may be experienced in the feet is plantar fasciitis. This is very common, similar to the changes in collagen as the falling arches, but this is very specific to the bottom of the foot, and it's also associated with changes in circulation. Progesterone, the other female hormone, is associated with changes and decrease in circulation and fluid balance. So experiencing heel pain means that the recovery may take a little bit longer. For both the falling arches and the potential of a plantar fasciitis that is slow to heal is where I may recommend to women to use an arch support. That arch support is maintaining the integrity of the foot while you are going through these different hormonal changes. Now, another symptom that you may experience in the feet is an increased risk of stress fractures. Estrogen, which affects collagen, means that it's affecting bones. And where we experience stress fractures in our feet is most commonly in the long bones, which are called the metatarsals. Now, the way that I approach stress fractures as a functional podiatrist is I focus on prevention. And the way that we prevent stress fractures is by keeping a very strong foot. We have 26 muscles in the bottom of the feet, and their job is to absorb impact forces. So strong intrinsic muscles of the feet can help prevent stress fractures in women who are going through peri and postmenopausal changes. A fourth and final symptom that you may experience in the feet is fat pad atrophy. Now, in our feet, in the ball of the foot and in the heel, we have fat pads. It is common to start to have a thinning and a wearing down of those fat pads, which can be very painful. The woman may feel like she's walking on the knuckles of the foot when you start to lose fat pad in the ball of the foot, or even the heel, a very sharp pain that you are bone on floor. Now, in this case, I often will recommend an insole that is made of plastizote. It's almost like a memory foam. This can bring comfort and accommodation to the foot where the fat pads are thinning or wearing down. Another recommendation is I like toe spacers. Toe spacers, which spread the toes, actually help lift up off of the ball of the foot. This is reducing pressure. Now, all of these symptoms, regardless of which ones you may be experiencing, I want to reassure you are based off of these different hormonal changes. So as you are working with your medical provider to maintain hormonal balance, do know that these symptoms will start to minimize. To learn more about how hormones affect your feet and how I practice podiatry, please visit dremilysplichal.com.